your thoughts when you see this dental chair? Do you think it looks sleek and new and wish your current dental chair looked like it? Instead of focusing on what you see, I want you to visualize with me the possibilities. I want you to see the many people, all varieties of people, who will sit in this chair. These people all have something in common. They have a lurking undetected disease, gum disease, a disease that is rarely discovered by anyone other than a dental professional. If you didn't know, this disease can affect your patient's total health and should not be ignored. I want you to see yourself next to the chair doing all manner of assessments to find this disease. I want you to see yourself presenting the evidence of what you find to your patients. I want you to see your patients' concerned faces as you tell them they have gum disease, something they've never been told before. I want you to imagine yourself being confident and composed and prepared with answers for your concerned patients. And I want you to see your patients being so satisfied with your explanations and careful answers to their questions that they schedule periodontal therapy treatment without delay. Can you see it? In school, dental hygiene students focus on periodontal therapy skills. They focus on disease detection and prevention. They pass their boards because they have mastered those skills. But sadly, because of a lack of real-world experience, a lack of continual coaching, the reality of time constraints in the commercial world, and usually a lack of clear office periodontal protocols, they start working and slip into the rut of becoming quote-unquote prophy experts. What they have been trained to be gets forgotten. I have done a lot of substitute hygiene in my 30-plus years of being a hygienist, and I typically get patients in my chair for a prophy who are anything but. How can someone with 5 to 6 millimeter pockets, puffy gums, active bleeding, furcations, active bone loss on their x-rays, and layers of biofilm be a prophy? How does this happen? I believe that with patience, redirection, training for the entire dental office, training in effective and current periodontal protocols, and boosting the dental hygienist skills, a dental hygienist can rise to be the improved, effective disease prevention and periodontal therapy expert that they were meant to be. You don't think it's worth it for you? Then let's talk numbers. On average, a hygienist will see 8 to 10 adult patients a day. On average, most dental offices work 4 days a week, which is 20 days in an average month. On average, that would be 240 days in a year. That means in 1 month they would see 160 patients, and in 1 year they would see 1,920. I know this may not accurately represent what you actually do, but this is only a scenario for teaching purposes. These numbers will be used throughout the building scenario for a comparison. For simplicity and teaching purposes, I will use the value of $100 for a prophy. This does not include x-rays or an exam. If a prophy is $100, in 1 day a hygienist will produce $800, 1 month $16,000, and in 1 year $192,000. Now, when periodontal therapy is done on a patient, on average a hygienist will produce $350 an hour. This is only for the therapy portion, not the x-rays, exam, or anything else. Let me show you what a difference doing 1 hour of periodontal therapy a day would have on hygiene production. In this chart, the new column on the right, which says Perio $350 per hour times 1, has a new value for the day, month, and year, which represents the hygienist doing 7 one-hour prophies and 1 hour of periodontal therapy a day. In 1 day, the increase doesn't seem like much, but it's actually gone up 43.75%. And in the month and year value, the increase is very noticeable. Exciting? Wait until you see what's next. The new column on the right represents doing 2 hours of periodontal therapy and 6 hours of regular prophies in a day. The values for the day, month, and year by replacing 2 hours a day with periodontal therapy have increased by 62.5%. Want to see some more magic? The last column shows what a difference doing 3 hours of periodontal therapy and 5 prophies in a day would make. The increase is 93.75%. That's almost double. As far as the question of the profitability of focusing more on periodontal disease and its treatment instead of regular prophies, I hope you see how beneficial it is. So now that I have your attention, let's talk about how this benefits patients. According to the CDC, 80% of American adults over 35 have some form of gum disease. Nearly 1/2 of Americans have periodontitis, the most severe form of periodontal disease. Gum disease correlates with many other diseases like Alzheimer's, diabetes, cancer, heart disease, and pregnancy and delivery complications. Gum disease is especially concerning because of the alarming number of Americans that die every year, on average 655,000, from cardiovascular disease, and gum disease is a root cause that derives systemic inflammation. So if there are 80% of Americans that have some form of gum disease and 50% that have periodontitis, that means that 50 to 80% of your hygiene visits should be periodontally related. But are they? What percentage of your hygiene visits are prophies? Let's take a second and define what a prophy is. A prophy is a dental prophylaxis performed on transitional and permanent dentition, which includes scaling and polishing procedures to remove coronal plaque, calculus, and stains. Tissue should be pink, firm, and no bleeding to only minimal localized bleeding. Probing depths are 1 to 3 millimeters. Scaling is done coronally and may include some scaling below the gum 1 to 2 millimeters. Prophy should take about 20 minutes. In the last point alone, judge for yourself if your hygienists are incorrectly treating your patients. Does your hygienist frequently go over in time on a prophy because the patient was quote-unquote more difficult? When you sit down to do an exam, do patients' tissues regularly look like this? Does the gauze have blood on it? According to the ADA's description of a prophy, there should be minimal inflammation to be considered healthy. How many of your patients do you think really fall into the healthy category? With all my years of experience as a hygienist, I can probably count on one hand how many truly healthy patients I have seen. Almost everyone has some form of inflammation, and if the inflammation from the mouth correlates with disease in the body, it needs to be stopped. How do you determine if someone has gum disease? When I train dental offices in periodontal therapy, this is discussed in detail because the initial discovery of gum disease is a very crucial step to a patient's awareness and their accepting treatment. How should periodontal treatment be done so that patients are given the best opportunity for comfort and healing? There are a variety of diagnostic and treatment options available for the discovery and treatment of gum disease. Which ones are absolutely necessary? Which ones will dental benefits cover? All of this is discussed with advanced training. Advanced training allows for customization based on your office's capabilities and equipment. Solid periodontal therapy protocols can be established. What are your thoughts when you see this dental chair now? Are you starting to get a vision of what possibilities this chair can bring for your practice and for your patients? Can you see it now? When trying to increase dental office productivity, most practices focus on outwardly bringing more patients into the practice. I'm suggesting to focus on the patients you already have and offering more services for their benefit. And even if you don't intend to advertise, your level of care and expertise will get out and attract others. Trust me. Most patients have dental benefits that can be used every year, but if they are not fully utilized by the end of the year, the money is absorbed by the insurance company. If you have more services to offer your patients, you can use up their benefits in a way that helps them and also profits you. If you want to learn more about how to have a winning dental team that stands out amongst the rest and a periodontal therapy program that creates winning results for your patient's health, I would suggest contacting me. I lead you in your office step by step through training. I especially work with a hygienist in advanced periodontal therapy techniques. Disease is out there. Don't let it slip by. You can save lives, and while helping others, you are creating exciting, profitable hygiene for you.